Training considerations for trimester 3. Some of the strategies you were using in the late trimester 2 are still applicable early on in trimester 3, but towards the end of trimester 3, you really want to focus on rest and recovery, deloading and preparing for labour and delivery. So the training is going to look very different from start to finish. You want to start reducing intensity and load and frequency of your workouts, and this is reflected in the program where we move from 3 workouts a week to 2 workouts per week. You can increase leisure walking here. It doesn't have to be a very fast pace, even 10 or 15 minutes to keep your activity levels up, move baby into optimal position, but to be gentler on the body. You want to start focusing on down training the pelvic floor. So you're focusing on stretches, breathing, all of those things to try and help reduce that tension in the lower abs and the pelvic floor, preparing for labour and delivery. Your pelvic floor is already under a fair amount of stress, and so is your core. So exhaling throughout the movement will help to support the core and the pelvic floor. So that goes for your breathing strategy, your posture and your alignment, making sure you're keeping those ribs stacked over hips, and exhaling is going to help to support those 2 structures. Again, if you are have some pelvic girdle pain or pelvic girdle symptoms, you can reduce the weights that you're using. Body weight is always fine. Change it up with stance, so go narrow, don't go as deep, and reduce the use of bands or lateral movements or single leg movements. So again, it's really, trimester 3 is really about focusing on that deload and detraining the body towards labour and delivery.